Okay, everybody, Dr. Ray Fitch from Vet Triage here. We are continuing through this issue of JAVMA from June 15, 2015. We're going to be talking about rabbits, the characteristics of bone fractures and usefulness of micro-computed tomography, CT or CAT scan, for fracture detection in rabbits. 210 cases from 2007 to 2013. This study comes out of Japan. Objective: to characterize bone fractures and the usefulness of micro-CT for imaging pet rabbits with fractures. Retrospective: so those who watch this channel know that with retrospective studies, the biggest issues typically are number of cases, but most importantly, standardization of cases, because we're looking at the cases back in history and not setting the study up and then collecting cases for the future. 210 rabbits owned by pet owners, and these rabbits had bone fractures. Results: 47.7% of all fractures in rabbits were less than 3 years old. Accidental falling was the most common cause. Vertebral fracture was the most common type of fracture without cancer, 23.2%. And most common area of the vertebral column was L4 to L7. The tibia was the most common site of fracture from non-cancer causes, 22.7%. And then 5.7% of fractures had cancer. And most of those were metastatic uterine adenocarcinoma. Females were significantly more likely to have a fracture caused by cancer than were males. And compared with radiographs, micro-CT provided more detailed fracture information, especially for complicated fractures or for structures that were complicated like skull, pelvis, vertebral, and comminuted limb fractures. Introduction. Rabbits' bones comprise a lower proportion of their total body weight. Multiplanar reformation images and volume-rendered three-dimensional images are particularly helpful in characterizations of complicated anatomic abnormalities. CT cannot be used to detect small orthopedic lesions for smaller animals, such as rodents and rabbits, and you also need anesthesia for CT, which further limits the scanning process for this species. Micro-CT involves use of microfocal source, range in slice thickness of 30 to 150 micrometers, very small. Usually for dogs and cats, it's in millimeters. And then two-dimensional or three-dimensional spatial resolution is possible independent of patient body position. Compared with conventional multi-slice CT scanning, micro-CT scanning requires much shorter patient exposure times. Fastest scanning time is 10 to 18 seconds. And in dogs and cats, it can be like a minute or a couple of minutes for really good CT scans, but 10 to 18 seconds is very fast. And this, of course, gives you high-definition images. Case selection. These cases were from 2007 to 2013. Medical records: long bone fractures were classified by origin. So humerus was number 1, radius 2, femur 3, tibia 4, and the position was also numbered: proximal 1, diaphysis 2, distal 3, and then severity: mild A, medium B, severe C. And this is the UNGER classification system, UNGER. So we never use this in veterinary medicine, but we should. That way, if you call somebody over the phone to get their opinion on radiographs, you don't have to necessarily show them the radiographs. If you specify the number system, then they have an idea of what you're dealing with. Imaging of fractures had been performed by use of conventional radiographs, digital radiographs, and the micro-CT. Okay, results. The age of those without cancer is 3 years old, which is significantly younger than those with cancer at 7.5 years old. 54.8% of rabbits were male, 45.2% female, median age 3.1 years, median body weight 1.6 kilograms or 3.5 pounds. Most of them were dwarfs at 70%, Netherlands dwarfs 15.7%, Holland Lop at 7.6%, then some other ones smaller. 1-year-old rabbits were the most common, and 47.7% of fractures were in rabbits less than 3 years of age. As far as cause of fractures, the most common cause was accidental fall due to human error at 24.8%, and other reasons were 22.9%. These included hopping while they were in the cage, 5.7%, and cancer at 15.7%. And here's some really cool images here of the micro-CT. C and E are radiographs, and you can see the level of detail compared to micro-CT. at D and F if you compare the same location. So pretty wild detail for micro CT. Metastatic uterine adenocarcinoma to the bone tissue was most common cause of cancer for fractures, followed by osteosarcoma, and then extraskeletal osteosarcoma, and then a bunch of others. Median age of this group with cancer was significantly higher than rabbits without cancer. Females were significantly more likely to have fracture from cancer than males. Fracture by metastasis of uterine adenocarcinoma, which is 8.9%. And that was seen in the unneutered female rabbits. Sites of fracture origin, not caused by cancer, were vertebral column at 23.2%, followed by tibia 22.7%, femur 13.1%, and so forth. Multiple fracture sites, 1.5% of rabbits. Limb fractures were seen in 63.6% of rabbits. 47.4% of those fractures were in one of three bone types, either radius, tibia, and femur. The ratio of forelimb to hind limb fractures is 1 to 2. The most common type of long bone fracture, not because of cancer, were simple fractures of the tibia shafts of 42-A, the radial shaft 22-A, and femoral shaft 32-A. In the 12 rabbits with fractures attributable to cancer, the limbs were the most common site of fracture origin. Sites of fracture origin in the 46 rabbits with vertebral fractures not because of cancer were in the T9 to L7 region. The L4 to L7 region was a common fracture site, making up 80.4%. And then here's some more images here showing you the detail of micro CT. All right, discussion. The age at which most fractures occurred was 1 year, which is the age where rabbits are most active because of reaching sexual maturity. Rabbits are prey animals, and so they get startled easily and are very sensitive to threats. Accidental fall was the most common cause of fracture in this study. Therefore, opportunities exist for veterinarians to educate rabbit owners on safe handling techniques. 5.7% of rabbits with fractures were confirmed to have tumors. Osteosarcoma, metastatic uterine adenocarcinoma, especially uterine adenocarcinoma, it's high in females that are 3 years of age or older, and even higher in 7 years of age or older. Hematuria, anorexia, abdominal distension are clinical signs. And then rabbits without these signs, but with metastasis to lungs, bones, and intra-abdominal organs, have a poor prognosis. In the present study, a rabbit with neurologic signs had vertebral fracture because of metastasis of uterine adenocarcinoma. Such fractures could develop in middle-aged and older unneutered female rabbits. In addition to osteosarcoma, metastatic uterine adenocarcinoma should be included in your differentials, especially in rabbits with fractures or lameness that are 7 years of age or older. Limb fractures account for 63.6% of all fractures. The tibia is the most common site, 22.7%. Segmental fractures were more common in this study for rabbits than were in dogs. Bone weight accounts for only 7 to 8% of total body weight in rabbits, and this proportion is lower than that of dogs and cats, which is 12 to 13%. Dogs with using the Unger system, which is again UNGER, found that simple fractures of the diaphyseal region of radius, femur, and tibia were common. Although obesity, decrease in muscle mass, and age-related weakening of bones were not evaluated in our study, fractures in older rabbits might have been influenced by these factors. Vertebral fracture seen in 23.2%, not attributed to cancer, and the cause involved human error. L5 vertebra was the most common site for fracture. Contrary to published information, the L7 was the most common site, and the L6 to L7 region was the most common site reported as well. Neuropraxia, an injury to the spinal cord, hemorrhage, pain, difficulty with defecation, urination, and death can occur with vertebral fractures. Comminuted fractures of long bones and fractures of the structurally complex skull, pelvis, and vertebrae were easily seen on micro-CT. The radiation dose with micro-CT is less than 10 microgray, which is much lower than doses that adversely affect the immune system of mice in other studies. I mean, this is great. It is a wonderful study. I think it was very well done, especially considering it was retrospective. They had a lot of information here for this, so this is a good one. Well done. Yeah, so for veterinarians, don't always assume that a lameness or fracture in rabbits is from trauma. We all assume that. We know we do. But if you actually work up the case, you might find cancer, which is worse. you know, but we shouldn't always blame the pet owner, although it is a very common cause of non-cancerous bone fractures. We should actually do a workup to figure it out, especially if the owner is considering euthanasia or supportive care with external coaptation or even surgery, and yeah, and so it just opened your eyes to that. And then for pet owners, educate yourselves on how to handle rabbits. Try to minimize trauma. These are preventable accidents that can occur, substantially preventable, and so make sure that your veterinarian, if they're working up your rabbit, is aware that bone cancer is another common cause of these things, especially if you haven't seen any trauma. So educate yourselves on how to handle rabbits. Veterinarians, educate your clients, and don't forget that cancer can also cause bone fractures in rabbits. We'll see you guys in the next one. Take care.